As healthcare workers, we dedicate years of our lives to learning, training, and serving others. Every single team member plays a part in making sure we're delivering the best care possible when seconds count. But the pandemic changed everything. Hospitals and nursing homes were stretched beyond their limits. The pressure, the grief, the sheer volume of loss. It left a mark. For many of us, it wasn't just exhausting, it was life-altering. And now, more than ever, we're asking ourselves, how much longer can we keep going like this? This is In the Heart of Care. I'm Dr. Ash Panchal, an emergency physician at The Ohio State University. In the emergency room, no 2 days are the same, but every day we deal with people in need of urgent care. We straddle a space between chaos and control, where split-second decisions, trust in our teammates, and readiness can mean the difference between life and death. Today, we're taking a closer look at burnout and how organizations like Corewell Health are working to support the people who keep the system running, healthcare workers on the front lines.
I'm Dr. Kristen Jacob. I practice internal medicine and pediatrics at Corewell Health, based in Michigan.
Dr. Jacob's role as the medical director of BeWellMED puts her at the center of a critical initiative aimed at supporting healthcare workers, something that, as we've discussed, has never been more important.
In this role, I have the opportunity to work with a team that focuses on supporting the well-being of our physicians and APPs, both employed and independently affiliated at Corewell Health. We also work very closely with our BeWell team, which is the team that's dedicated to support well-being for all of our team members. We know that it is incredibly important to support the professional fulfillment and well-being of all of our healthcare workers so that they can give the best care to our patients at Corewell Health.
When we talk about professional well-being and fulfillment, we can't help but talk about burnout. So, what is burnout exactly? It's something we hear about more and more in healthcare these days, but what does it really mean and how do we recognize it?
Burnout is described by 3 key dimensions. One is emotional exhaustion. This can be understood as when we are caring for patients and we're emotionally drained. It might result in chronic fatigue or difficulty concentrating.
Emotional exhaustion is often the first sign, when the energy we once had is drained and it becomes difficult to focus, let alone deliver the best care.
The next dimension that defines burnout is depersonalization or cynicism. This is where we might become detached towards work and the patients that we're caring for, might also become detached from our colleagues in that team environment.
Then there's the sense of detachment, a feeling of disconnect from both the patients we're caring for and the colleagues we typically rely on as part of our team. It's when the dark humor of the ER creeps in, the kind we use to mask the weight of it all. There's laughter, but with a tinge of cynicism. It's a defense mechanism, but also a sign of how deep burnout can go.
And then last component of burnout is decreased personal accomplishment. So that is a feeling like you are being ineffective at work, that you might have decreased in motivation, or that your efforts aren't making an impact.
When we lose the sense of accomplishment, it's easy to feel like our efforts aren't enough, that the work we're doing isn't making the difference we once hoped for.
This is the thread that intersects with moral injury. That's another term that we hear when we're talking about clinician well-being, burnout. And what moral injury is really we feel like there are barriers up that are out of our control, that we cannot give the high quality, high value care that we want to our patients. And that causes moral injury because it is a misalignment of the values that we know that we want to strive for, and that there are often system barriers, administrative, bureaucratic barriers, time constraints that prevent us from being able to give that care to our patients.
So those are the signs of burnout. But what does the research say? Over the last 15 to 20 years, burnout has become an area of serious study, particularly in healthcare. And as Dr. Jacob shared, burnout isn't just an individual experience, it's a systemic issue.
One thing that we try to level set for our colleagues when we are introducing the importance of self-assessment is being very clear that we do not have a resiliency deficit as physicians and healthcare workers in general. We are showing up to medicine as some of the most resilient people in our population. And even those that score at the highest end of the resiliency, when we formally measure it, are still at risk of burnout. And it's so important for the population that we serve to level set here because, again, we pride ourselves on that level of being able to take care of our patients with high acuity, high volume. That being said, it is not always within our typical day or habit pattern or culture to stop.
This understanding, burnout as a systemic concern, not a personal failing, has been echoed by decades of research. One of the foundational studies comes from Moslock and Leiter, who've been leading research on burnout since the 80s. They shifted the conversation, showing that burnout isn't just about personal stress, it's about the structures and demands we're working within.
We know that 80% of burnout is attributable to system-level factors, not personal resiliency. And so while personal resiliency is incredibly important, and we have a lot of programs to support that, we also have programs to address that organizational level and are moving more into that space. Where we're moving and where a lot of our work has been focused after building those foundational tools and programs is looking at getting ahead of the drivers of burnout. How do we start to address and prevent burnout by looking at more of the organizational levers and tools?
That distinction is critical. Burnout isn't just about how tough we are, it's about the systems we're working in and whether they support or strain us. At Corewell Health, that shift in focus from treating burnout to preventing it has led to a more strategic approach, continuing the early day research to new models that reflect today's challenges.
The model that we use is the Stanford Professional Fulfillment Model. This is a model that encompasses 3 key domains: fostering a culture of wellness at the organizational level, prioritizing efficiency of work or efficiency of practice, so reducing the administrative burdens that we see impairing us from being able to do the work and get the care to the patients that we want, and then personal resilience. But we also always point out that a culture of wellness and a efficiency of practice, that's at the level of the responsibility of the organization.
And for many healthcare workers, especially those in emergency or high acuity settings, there's little time to process trauma before moving on to the next patient. But creating space to reflect, even briefly, can be critical to long-term well-being. At Corewell Health, they've developed a system-wide approach to do just that.
We have a program called CISM, that stands for Crisis Intervention Stress Management. This is a framework and a program that has data that is helpful for healthcare workers to debrief after a traumatic event, a high-stress event, patient outcome.
What makes this program special is that it's embedded. Hundreds of staff across Corewell are trained in this method, helping teams debrief quickly and thoughtfully, often within a single day of the event.
We have hundreds of trained CISM facilitators from around the organization. There's a framework that's used for different types of debriefing events. And this is available to be done ideally within 24 hours of that event. And everyone on the care team that was involved is invited to this debrief opportunity. We also know that although group debriefing is helpful, one-to-one debriefing and peer support is another opportunity for support. We've had historical peer support programs around the organization, and we still feel that this is an important investment. Peer support is confidential, one-to-one debriefing that is structured and really gets into active listening, validating, authentically checking in. We're not debriefing the medical details of the case. We're debriefing that emotional response and how someone is doing after an event like that. We are actively revamping our peer support and looking to scale this throughout Corewell Health in a more robust fashion over the next year. We continue to look at this crisis where we have an increasing acuity and volume of patients, and we have a waning healthcare workforce. And when you look at the projected numbers for both those that are entering healthcare and those that are thinking about leaving healthcare, the reality of that juxtaposition of higher acuity needs and volume for patients and decreasing workforce, it is a crisis that we need to think about. How do we approach healthcare in a different way? How do we work smarter, not harder with the resources that we have? I often will recommend the framework that's available through the National Academy of Medicine. They offer a framework to help organizations that are thinking about supporting our healthcare workers with well-being, and it includes 6 essential elements: advancing organizational commitment, strengthening leadership behaviors, conducting a workplace assessment, examining policies and practices, enhancing workplace efficiency, and cultivating a culture of connection and support. And I'm grateful that I am at an organization that is really trying to think strategically about that.
So we've gone over the signs of burnout and how much of it stems from the systems we work within. But here's the real challenge. How do we actually talk about it? In a world where the pace never slows down, how do we make space for honest conversations about stress, exhaustion, and support? To dig into that, we turn to someone who understands the power of both showing up and speaking up. Sarah Lorenzini is a rapid response nurse. She's the one who gets called when things get critical. And she's also the voice behind the Rapid Response RN podcast, where she tells real stories from the front lines of care. She joins me next. Hey, Sarah, it's a pleasure to have you. Thanks for joining us.
Thanks for having me. I'm super excited to be a part of this conversation.
Well, I know burnout is a topic that we're both really passionate about. And I think more than anything else, we know that it affects all of our people, our friends, our family in such a tremendous way that this conversation is really timely.
Yeah, for sure. Especially right now, coming off of COVID, this is the time to be diving into it.
Well, one of the toughest things that I've experienced is that it's really hard sometimes to start these conversations on burnout, especially in some sort of real way that you're really engaging with people. How do you manage that?
When I hear a little comment or a little inkling or I can see in someone's facial expression or their body language that burnout is there, I think that's my introduction or my invitation rather to bring the conversation up and to check in with someone. I prefer to do it one-on-one, to check in with a colleague and see how they're doing. You know, I've seen just so many amazing healthcare professionals that have unfortunately left the bedside and left healthcare because of burnout. And I really want to do my part to keep that from happening in the future because we need more nurses, we need more physicians, we need more nurse practitioners and PAs. I mean, we need more. And so I will continue talking about this with every opportunity or invitation that I can find myself in.
Well, I love that you said it that way because for me, it's the same thing. It's like you try to break into that moment and so many times you just have to catch them at the right time. And I think back now to when I started my career and we didn't even talk about this. Do you think that burnout now is showing up a little different compared to when you first started?
Oh, for sure. I remember the first day of nursing school, them basically saying like, this is hard. You got to suck it up. You're doing this for a good cause. This is just how it is. It's long hours. It's hard days. It's heavy emotions. You're tough enough. You can do this. You're a nurse. And thank God that is shifting because I think that approach is not effective, especially when we're seeing all the more moral distress in healthcare. As staffing challenges are worse. There's the financial component. Now is not the time to be telling nurses to suck it up. There's a lot more to the conversation than that. So I think things are finally shifting, and I am very grateful for that.
Yeah, it doesn't mean that there is a different pathway. We're people. We're all people engaged in this life that we're living, but at the same time, taking care of other people and pulling in their feelings into what we're doing. And the stress of our work itself is what's putting us down a lot of times. Do you have any strategies that you use to break down the barriers to actually start these conversations with people?
I think for me, it's just leading with compassion. I've learned to just deal with it because it's important. But I think because I care for the people that I work with and also care for the patients that they are responsible for, I let that be the driver. I will put aside this uncomfortable feeling of having to approach someone that may be a difficult conversation, knowing that the outcome might be they might just stay in the profession. They might show up in a healthier way tomorrow. They might be able to give better patient care because of it. And so I think my strategy is there's no special magic sauce that I have, just that I let compassion be the driver rather than frustration or annoyance or something like that that might lead me to want to confront someone about their behavior.
I was kind of hearing a little bit about the check-in as a possible support tool too, to open up that conversation, it sounds like.
I think that term check-in is becoming more and more familiar. But I think the conversation's changing where people are more open to a check-in, to someone giving them feedback and maybe supporting them in this very high stress environment, which is managing patients who are ill and crashing. Or I think that people are more open to the phrase, can I check in with you versus I need to talk to you. I often will pull someone aside and be like, what's going on for you? How are you feeling? Have you been working too many shifts? Have you taken days off? What's going on in your world that you're not able to show up as the Tamisha that I know or the John that I know? Or like, I usually will do it kind of just one-on-one. I think check-in is a good, safe introduction.
So Sarah, one of the challenges I have of unpacking this whole thing is while I'm at work, especially in the emergency department and doing my thing, seeing another patient, tending in another chart, ordering another lab, we're all day long talking doctor speak or nurse speak where we're just using jargon and keeping ourselves at that 10,000 foot level. So we kind of protect ourselves, put ourselves in that shell, right? It becomes really important more and more for us to talk about this at work, but probably even more at home.
There's a couple things I think that we can do, especially as leaders in a department. You know, if you're the physician in the ER and the rapid response nurse, it's kind of shifting the culture around emergencies. This culture of like, this sucks. We got to push it down and move on. We got more stuff to do. If that's the culture we're promoting, no one's going to feel safe to share how they're feeling. They will just fall in line and do the same exact behavior. But if we as leaders can shift the culture and shift it towards, that was hard, but we are here for each other. Let's process it together. Let's show up for each other. Do you have any questions? How can I help you? I think if that's the norm, that's the culture, then people will feel safe to open up and process the hard stuff. I think that the reason why I am 21 years into this profession and I've only ever worked in high stress emergency environments, the reason why I can still show up and love it is because I have taken time to face the hard emotions and to deal with them and process them. Not just in the moment with my team, but also on my drive home, getting home to my family. I have certain safe people that I can talk to about really difficult stuff I've seen on my shift. I'm a podcaster. I love podcasts, but typically on my drive home, I'm not listening to anything. I usually drive home in silence, honestly, so that I can take time to process what I saw today, how those interactions went, what did I do that was excellent, what connections did I make with patients, and also what could I have done better, what was difficult, what was sad, and just take time. I mean, I have like a 20-minute drive home, and that is like my own personal debrief.
Just reflecting on what you said, it's almost as if that change in culture that you're describing is instead of just observing, assessing our patients, we're starting to turn that vision onto ourselves. And a lot of times when we think about our partners at work, they're our safe space where I can do the dark humor, I can do all these things, and I can say it and it's okay. Whereas culture needs to change where we're not saying that as much and we're reflecting back, wait, you just said something unbelievably sarcastic and just dark that, okay, we need a moment to talk about that. Man, that's a real culture change for all of us, isn't it?
It really is, but it's so needed. And to be honest, it doesn't take that much extra effort. I think we think, oh, there's so much to do. We don't have time to debrief. There's so much to do. We don't have time to check in with our colleague. Well, maybe if we took the time to check in, we would all be more efficient and effective. rather than just barely making it, pouring out from an empty cup and just like running on an empty tank or whatever analogy you want to use. If we show up whole, I think that we could all function a little better.
Right. I want to take you to a different space.
Sure.
So as a rapid response nurse yourself, you're hitting the floors, critical patients, you're on the front line when everything is going bad, right? So the intensity and the high stress moments are exacerbated in that situation, right?
Mm-hmm.
So how do you handle some of these more intense, stressful things and balance that against your own sense of burnout?
Oh my gosh. I love this question because I remember a moment where it kind of hit ahead and I had to like do an intervention to fix the situation. So think back to like the height of COVID when I swear I intubated 10 patients a day. I just went from one crashing patient to the next, not just elderly patients that I'm used to intubating, young, otherwise healthy people. I was just seeing so much trauma, so much loss, so much grief. It was just like bad news, bad news, bad news all day long. No one called me when their patient got better. I am called when patients are not doing well. I remember just feeling like, does anybody recover from COVID? Does anybody get better? I just hit a breaking point. Actually, a friend of mine, we had to intubate and he did not do well. And I remember I got home, I processed and thought through all of it. And the next day I got to work and I called the charge nurse on the med-surg COVID floor. And I was like, listen, I have a crazy request. Can you please call me when patients are getting better? I need to see some wins. I think one of the balances to taking time and working through the hard stuff is also taking the time and celebrating the wins. Or the patient that does get better, or maybe they didn't get better, but you got a chance to be with them in their final moments, or you got to connect with the patient or the family, or you got to be a part of a beautiful experience. Like you get to see humanity at its worst and also at its best in the hospital.
That's amazing. It's seeking those good moments to stay mentally resilient. Just on a side story, we just had a survivor event at my EMS agency where we had the people we just resuscitated that year. We had 3 of them who joined us with their family, and their moment of thanks, that brief moment, there wasn't a dry eye in the house,
I know.
but the upsurge of energy and joy, I mean, it was amazing. And actually, I want to jump off that idea because you've gone through this long nursing journey. It sounds like you've had these strong experiences that led you both ways. Through all of this, have you rediscovered that joy that you started with in nursing?
Oh, absolutely. It has been a ton of mountains and valleys throughout my career. I've learned multiple ways to mitigate some of the risk of burnout. And so now I've got a pretty good system in place for processing the hard stuff and celebrating the wins and finding ways to advocate for myself and keeping myself challenged and finding ways to fill my cup and not just show up empty.
You're listening to In the Heart of Care, a podcast about leadership in healthcare, where we explore what it really takes to build strong teams, foster resilience, and stay ready in the moments that matter the most. We're brought to you by RQI Partners, a partnership between the American Heart Association and Laerdale Medical. If this conversation's hitting home or brings someone on your team to mind, send it their way. And don't forget to follow the show. More episodes on leadership, teamwork, and readiness are coming your way. I love that you're reflecting back to that time period because I think both of us, probably many of our listeners have experienced the same pandemic experience, right? Truly remember those moments. It sounds like your communication and how you relate to this concept of burnout is also changed through that experience and through the pandemic. And I'm hoping that's true for everybody. Do you feel that's true for you?
100%. I think that I didn't really talk about burnout very much before COVID. I think with COVID and we're seeing so many people leave the bedside and this phrase is, I am burned out and that's why I'm leaving. That's when I had to kind of adjust to myself like, oh, am I burnout? Am I having some of these symptoms of burnout? I haven't reached the point where I'm done, but man, I've had some moments where I wanted to be done with nursing. I was forced to face it, I guess is what I'm getting. I was forced to face it with COVID. And ever since then, it's something that I will continue to be aware of in the way that I'm responding to especially stressful shifts and in the way that I respond to my colleagues, just being more empathetic and understanding. Burnout is an epidemic as well that we need to do something about. This is problematic. It's not like we're like, COVID caused all the mean, cranky nurses to leave. It caused some really great people to not feel like they had the capacity to keep showing up in this very stressful environment. And so we have to find some ways to mitigate that. So I am constantly on the lookout in myself and in my coworkers when I see little twinges or hints of burnout popping up here and there. I want to support my teammates. Ignoring it never makes the diabetes go away, never makes the burnout go away either. So we have to actually face it head on and do some things to mitigate the risk.
I love the idea that through our discussion, through our culture, through all of these tough times that we've faced, that we are actually addressing some of this by just becoming more aware and becoming more comfortable with the discussion. In pop culture, one of the things that I'm realizing the more I watch TV is that everyone knows Code Blue. Everyone knows that we're going to lean in as a team and save the patient and get that good outcome. But the reality sometimes is a little different for us behind the scenes. So how do you encourage our teams, our nurses to seek that mentorship that you've seen that is so impactful?
Yeah. I tell all new nurses, the first thing you want to do is find someone who can be your mentor. A nurse that you look up to, who feels safe, that you can process hard stuff with, you can ask the questions to. It doesn't have to be the person that's like your assigned trainer, your assigned preceptor, but someone that you're like, okay, that's kind of what I'm aspiring to be. How can I glean some wisdom from that person? And to a nurse who's been around for a while, I think you should seek out people that you can nurture and care for and give back to and mentor. And the thing is, it's a win-win relationship for both of y'all. So the person that's being mentored, they get an opportunity to process and have a sounding board and get some wisdom. But for the person that's giving that, it's not just a give situation. They actually get so much out of the opportunity to hear nursing through a fresh lens. I think it's just a win-win situation. The mentor gets so much out of it. It's so life-giving to support another teammate. And for the newer person, it feels so safe to have someone that you can process this stuff. You don't have to just keep it all in. And even 21 years in, I still have people that I consider my mentors, that I look up to, that I call and ask questions to and get advice from. There's always someone that can mentor you, even if you're like the most experienced nurse on the floor.
Completely agree. I mean, it's building that personal community, right? These are our well, I want to say it a little off the cuff, but these are our caregivers in a real sense. But
yes,
we never really talked about that when we were younger. And now it's great that we're opening the conversation. We've talked about it a ton, but I really want to come back to one concept map for us. I want our listeners to take away something about this concept of burnout. And what do you think the most important advice for you would be to offer them to navigate all this?
I think that it's important, one, just to recognize that it exists. Ignoring it, pretending it's not a thing, is not helping anybody, it's not helping you. I think, to be very honest, burnout is coming for all of us. It is impossible to work in healthcare and to see all that we see, to deal with all the stress that we have to face, and not to have burnout knocking at our door. So just being aware that it exists, I think, is step one. And step two is learning some strategies early on that can help prevent it and manage it, and talking about those openly as if they're normal things to do. I think the culture when I was a new nurse was you work hard, you show up, you pick up overtime. That's what you do as a teammate. Sacrifice yourself for the sake of the team. And that didn't get us very far, especially in COVID. Find ways to make it normal that we are trying to prevent being burnt out, and to recognize that in someone else and to encourage them to do those behaviors that will support them, rather than encouraging behaviors that are going to like beat someone into the ground and make them want to leave the bedside.
Sarah, that is amazing. I think your passion, your focus, even your care for this topic and the people around it and our community, it just shines through. Thank you so much for joining me today. This was amazing.
My pleasure. My pleasure. Thanks so much for having me.
Thank you for joining me on In the Heart of Care. Burnout in healthcare is a real challenge, but by supporting one another, we can face it together. I hope this conversation has sparked some reflection and hope on how we can all lead with intention. In the Heart of Care is brought to you by RQI Partners. Our producer is Ebian Abdir. Our sound engineer is Luke Badio. Our project lead is Miria St. Obed. Additional production support is provided by Jar Audio. To download resources related to today's conversation with Dr. Jacob and Sarah, please visit rqipartners.com/podcast. I'm Dr. Ash Panchal. Stay strong, stay connected, and keep leading with care.